Thank you so much for joining us this afternoon for this panel discussion on the state of Black health. I would like to begin by introducing our amazing panelists for the afternoon. Panelists, please feel free to expound if I mistakenly leave off any of your credentials. First, we have Dr. Kimberly Perkins Davis. Dr. Davis is an associate professor and chair of the oral surgery department. Additionally, she serves as the program director for the oral surgery residency program and she's the director of graduate programs in the School of Dentistry. Dr. Davis is also the assistant designated institution official. Next, we have Dr. Donald Alcindor. Dr. Alcindor is the associate professor in the Center for AIDS Health Disparities Research and the Division of Microbiology and Immunology, Physiology, and Obstetrics and Gynecology at Meharry Medical College. Dr. Alcindor is also the Director of Research for the State of Tennessee SEAL program. We also have Dr. Theodora Pinnock. Dr. Pinnock is the Associate Dean of Student Affairs and Admissions in the School of Medicine at Meharry Medical College. Dr. Pinnock is a pediatrician who provides developmental and behavioral science services at the Meharry Clinic. She is also an assistant professor in the Department of Pediatrics at Meharry Medical College. Last but not least, we have Dr. Calvin Smith. Dr. Smith is an assistant professor and board-certified clinician in internal medicine at Meharry Medical College. He also serves as the clerkship director for the third year internal medicine rotation, as well as assistant dean of admissions and chair of the admissions committee for the School of Medicine. Dr. Smith also serves as the vice chair of the Metropolitan Nashville Board of Health. I am your moderator for today. I am Courtney Blakemore. I'm the Director of Corporate and Foundation Relations in the Division of Institutional Advancement at Meharry Medical College. Welcome to all of our panelists and guests, and thank you for your participation in today's discussion. Now we will move into our panel discussion. If you have any questions, please enter them into the chat, and we will answer them after the panel discussion as time permits. So let's begin. As we all know, COVID-19 exposed what we already knew in the Black community about the inequities and inequality in healthcare. COVID-19 further brought to light the health disparities and has widened the gap that exists in the Black community. So panelists, have you experienced this in the work that you do every day? I know that the dental school played an intricate role in ensuring that our Nashvillians were getting tested as well as vaccinated. So Dr. Davis, if you don't mind, please lead this answer, and then we would love to hear from Dr. Smith and Dr. Pinnock, who we also know both serve as clinical leads at one of our largest testing sites in Nashville. So Dr. Davis?
Absolutely. Thank you so much for having me. So as you mentioned, the dental school played a leading role in the testing of the COVID-19 pandemic. And so that was very, very instrumental for that. And I was very proud to be a part of that. Also, during the pandemic, many dental offices were forced to close for a period of time and only treat emergency patients. But the School of Dentistry never closed. And so we were open, we remained open, and we treated emergency patients during that time. And what we noticed was so many oral health needs throughout the community. And it brought to light the fact that oral health is total health. And the myriad of reasons on why patients neglect going to the dentist, whether it was fear, embarrassment, finances, or time, the fact that oral health is the gateway to the body so that we can detect a lot of illnesses through the oral cavity. And so that was very interesting to see. And the fact that we had so many patients coming in during the beginning of the pandemic, it brought to light so many different things. So very interesting to see.
I would like to say from the pediatric side, we already knew about the disparities, but one of the things that was very evident to us from March of 2020, probably until last August, when kids started to go back to the classroom, was the immunization rate of children fell almost precipitously during that time. And there was already a disparity with kids of color getting all their immunizations on time, and usually a lot of catch up being when it was mandatory for daycare or for school. But with the pandemic, we saw a definite drop off, and it didn't start going back up to usual rates until this past August, when they went back to school. And I just noted that in today's news that both Pfizer and Moderna may start as early as Monday for vaccinating kids under the age of 5 now with the COVID-19 vaccine. So that's something that I think our community needs, and that was a disparity as well.
Yeah, and from the internal medicine perspective for adults, I mean, the impact was devastating. We saw where disparities were very clear in terms of the outcomes for the patients that were sick with COVID, especially in the early phases. The patients that had comorbidities, which happened to be, in large part, a lot of African Americans of lower socioeconomic status, it was devastating for them. And the even still in this phase of the pandemic that we are in, seeing the long-term effects, the downstream effects for these patients, and the lack of access to care for some of the things that really, there should be protocols in place for, things like kidney disease, blood clots, things of that nature. We're still seeing a pretty significant impact in terms of health disparities and the structural racism in place, which is keeping people from getting the care that they need. So this was a life changer. This was a game changer as far as the internal medicine standpoint, and everybody's standpoint, really. But I can only speak from my end. It was a game changer for us, and it shed a lot of light. And we're still trying to have that light shed on the various areas, but it's difficult now as things start to fade out in terms of the focus from the media, etc. But these disparities still exist in a large sense. So it's been really it's been challenging, and it's been a worthwhile challenge. It's been something that has been fulfilling in my life personally, but also has been something that's taken a tremendous emotional toll.
Yes. So I'd like to say something about this. So I work for the Tennessee SEAL. I am the director of research, and my job is to be embedded with the vaccinating groups, the vaccine strike teams. And what I do is provide information for them regarding the vaccines, the effectiveness of the vaccines, any questions they have about the virus as well. And so what we saw is disparity that were pre-existing, and COVID-19 came and added to that. And so when you think about disparities, these disparities in terms of diabetes, heart disease, cardiovascular disease, hypertension, that was existing in the Black community far beyond COVID. And then you had a virus that came in, and this virus said that if you had all of those underlying comorbidities, I'm going to make it worse for you. And this virus did that in so many ways. It also said that if you were obese, if you were pregnant, and you had any kind, and if you're older, this virus was going to do something very special to you. And it wasn't anything good. And the idea is that we had to protect ourselves. And so one thing that the Trump administration did right is that they provided $10 billion to a half dozen companies, Moderna of which had never produced a sanctioned FDA-approved vaccine, got in the mix. Pfizer, a lot of experience. Again, BioNTech really helped them along the way. But what they were able to accomplish was something that was very important, and that is to deliver 300 million doses of a safe and effective vaccine by January 1st, 2021. There were two companies that were able to do that, Pfizer and Moderna. When you look at the impact of the vaccines over time, they have made a clear difference. And when you think about vaccines in general, we have a lot of experience with vaccines. I talk to parents all the time, and I ask them, how many of you have school children? A lot of them. It is mandatory for you to be vaccinated if you go to public school in America. And the idea is that from birth to 18 years old in America, you're going to get 74 vaccines. Some of them will be boosters. And so when you look at what vaccines have done overall throughout time, vaccines have been one of the most safe and effective public health interventions that we have ever known. And the idea is vaccines has allowed us to live 30 years longer than we did 100 years ago. And vaccines will continue to be safe and effective. And when you think about the side effects of COVID-19, if you get that vaccine, it is minimal to being able to suffer through, you yourself, a parent or a loved one, through COVID-19. And again, we have so many people that are still unvaccinated. As we speak today, we have 54 million people that are unvaccinated, remain unvaccinated. Many of them are vaccine hesitant or vaccine resistant. We have 91 million people that have yet to get the boosters that they're eligible for as well. So what we have is an elderly community that has underlying medical conditions that are still at risk. This virus is not done. And the idea is that right now, as we speak, Nashville is in the red zone for COVID, and masking is coming back. And so what I'm saying is that the pre-existing disparities were pressured by the COVID-19 vaccine, and that continues until today. But the disparities are linked. And again, when you think about disparities being linked, it's chronic diseases that we have had that have been unmanaged over time. And the idea is that we would die from this overall if COVID wasn't there in time. And so there needs to be an intervention at the level of awareness, education, and intervention to bring about the broad scale management of chronic diseases in America that face Black and brown communities.
Thank you so much. It's great to have different thought perspectives and the fact that we have pediatrics, internal medicine, dentistry, and research. So thank you all for sharing your answers. So if you all would, please tell us about the state of Black health. Are conditions improving or worsening for our community? Let's start this one off with Dr. Smith.
That's that's a tough question for me to really answer straightforward. I'll say that we are improving steadily. The state of Black health in our communities is improving steadily, but it still has a ways to go. I think that we are fighting a battle of mistrust and not recognizing the various violations of the trust of our people over years. And I think that where we stand in terms of trying to heal that trust and to rebuild that trust, we're working at it. I think that when you look at certain numbers, such as the numbers of African Americans that are physicians, we have a long way to go. Those numbers are strikingly similar to what they were 40, 50, 60, 70 years ago, and should not be the case, because our enrollment numbers are up at institutions, not include, in Meharry and Howard and Morehouse School of Medicine and Drew, we've been holding it down for years. Okay. Our enrollment numbers are up in other schools, but as far as actual practicing doctors, those numbers are the same. And so you have to ask yourself, where's the disconnect? What's happening at these other institutions? Why are we not getting these students through? And to that end, we're seeing those outcomes in the patients, because patients do as well as the doctors that provide for them. And if the doctors that provide for them don't see them as humans, don't view them as human beings, they're not going to treat them in an equitable and effective way. And so, to answer the question, we have made progress. Certainly the state of Black health is better than it's been, but we have a ways to go, in my opinion.
Okay, anyone else?
Well, I'll tell you that, as Dr. Smith said, we made some progress, in particular in the aspect of obesity in kids of color. Obesity actually is down 6.3% across the country, and even more in kids of color and Asian kids. And part of that is due to improving food deserts. And so kids had a healthier choice. The other part is school realizing that it was very important for kids to be active and putting active minutes back in school, that they would be doing recess and playtime and actually gym and physical health and physical education again. So those things are moving in the right direction, or obesity is moving in the right direction. However, I'll talk to you about the A's in pediatrics. The other A's are going well in the wrong direction. Allergies and asthma. This particular statistic blew me out of the water. The death rate for Black children with asthma is 500%. I don't know what to say about that. I really didn't realize that. I practice mostly developmental and behavioral medicine, so I'm not seeing kids necessarily with asthma or treating their asthma. But we've really got to get a grip on that one from a public health side. Also, anxiety and depression are going up in our children, and a lot of that has been post-pandemic. One of the things we've talked about, some of the health impact, but I think what we've sort of failed to realize is the grief impact for COVID-19. We lost a lot of people, over 1 million in this country, and children were impacted. Some children lost their major caregiver. And so we often will get counseling and stuff for adults when they lose folks, but I don't think we moved fast enough or proactively enough to do that with children. And I think we're seeing fallout now, or complications due to that. So we have a ways to go, and especially on the mental health side, to be a lot more proactive for our kids of color. And let me just add one more, since I'm a developmental pediatrician. Autism is going up. The numbers this year are 1 in 44. The problem in our country is that Black children, and that's the only kids of color, Black children are 2 to 3 years behind anybody in getting identified. That is a travesty to me. And we just got to do a better job of getting kids that have autism to service quicker and get them identified quicker. And I could share all day with the causes, the possible causes, but they're the only group of children that have that statistic. So we've got work to do.
Yeah, so I want to say something here. I think when you look at Black health over time, you have to filter this through the social determinants of health. And when you do that, I see marginal differences, very marginal differences, however, incremental in ways. When you look at major infectious diseases in terms of chronic morbidity and mortality in the population, in terms of COVID-19 and HIV, we are seeing reductions in HIV in certain populations, particularly African-American women. Again, when it comes to COVID, we are starting to see COVID-19 deaths go down among African-Americans and Hispanics. And so marginal differences, but when you look at social determinants of health, I don't see any, what I would call clearly significant gains when you look at in terms of those individuals that are in poverty and how poverty impacts all of the social determinants of health in terms of where you live, if you go to school, where you go to school, what you eat every day, how you interact with your other community partners, and of course, how you access the healthcare infrastructure. When you look at all of those things, Black and brown communities have had a loss for a long time, and even more so during this pandemic.
Thank you. Great information shared. Guests, don't forget, if you have any questions, we have experts right now. So drop your questions in the chat and we'll get to them as soon as we get a chance. So what do you all think are the main drivers of Black health disparities? Let's start off, Dr. Alcindor. Let's start
Yeah.
off with
So I think the foundation of health disparities is poverty, lack of awareness, education, and information. When you take those things away from a particular group of people, they become isolated, unable to perform, unable to drive and develop wealth, to have ideas to make a difference. On top of that, when you take away political capital from a people, what happens is that they have no say in how they're going to be allocated in terms of funding and so forth. So when you look at poverty, poverty impacts all components of social determinants of health as well. And so when on top of that, you have layers of social inequities, racial discrimination as well. And when you put that together, it basically will allow you to sustain health disparities and make those health disparities generational. That means that if you grow up in a particular situation and there's no interventions there for you to survive that situation, then whatever that situation is, whether it be poverty or basically subjected to a number of health disparities, then that becomes generational, meaning that unless there's an intervention to change that, it is going to be inherited. That is poverty, lack of education, lack of awareness, health conditions that are chronic, that are unmanaged, and so forth.
Yeah, I 100% agree with what Dr. Alcindor just said. It is absolutely 100% a corollary between the poverty that exists and social determinants of health. Structural racism is a big problem in healthcare, all the way down the line, from the education of doctors to the education of our patients and the delivery of the healthcare system to our patients. And we have to root it out. We have to root out this racism and discrimination along all the lines of the social determinants of health: economic stability, neighborhood and physical environment, education, food, community safety and social context, healthcare systems. Racism has its hands in all of them, and structural racism to a point. So, I'm involved in, as you mentioned in the outset, involved in a lot of different aspects of healthcare here in Nashville, and just the institution of diversity, equity, and inclusion into some of the existing structures here. And I don't want to be specific, but inclusion of that gets so much pushback from those who aren't affected by it. They see it as a threat, as a security threat, as a threat to potential experience, however you want to classify it. There's pushback the entire way through, and all of it is rooted in structural racism and the benefits of privilege and of pre-existing capital, all these kind of things. And when we talk about these generational curses that Dr. Alcindor is talking about, these cyclical things that go on, it benefits. You have to realize who it benefits, and you have to understand that those that it benefits are not going to rest easy and allow for change to occur. We have to advocate for ourselves in a lot of different ways, but we have to be aware. We can't be in denial that these things are ongoing and how they affect us at every single level, no matter what we have, no matter where we stand in terms of respectability and things of that nature. Our titles don't save us from racism. Our titles don't. Our positions in our communities don't save us. Our political offices don't save us from when the rubber hits the road and they start dividing us up. We saw that in the Ukraine when there was a war in the Ukraine, or when the war started. That the people of color were the last on the buses. You know what I mean? There's no coincidence that these kind of things happen, and you have to be able to recognize that all throughout our structure, the social and economic inequities are all tied in with racism and discrimination. That goes all the way through.
I'd just like to raise a point in the president's funding for earned tax child credit. We almost, for almost 6 months, reduced childhood poverty in double digits. But since everything's expired, and I don't think I have to inform anybody that's listening today, I would tell you, even the last month, things have almost gone back way beyond what people started with the earned tax credit, with gas, with groceries, with the sky high prices in every area. Those gains have not only been just evaporated, if you will. I think there's going to be a post fallout side of what we're experiencing now in our country with inflation. So don't wait till November to start voting. And there's been definite efforts to keep our vote. We've got to do something. We've got to do something. If we can give billionaires tax breaks, we can give our children earned tax credits. To me, that's just the bottom line.
Absolutely. So conversations regarding mental health and eliminating the stigma are more common now than before. How urgent are these conversations and services pertaining to mental health in the Black community? Dr. Pinnock, I know Meharry is in the process of doing a mental health assessment, so I think this question would be perfect for you to lead.
As I stated before, mental health, and especially in our community, is something that we need to be proactive about. The pandemic worsened some things for us, in particular loss. There was ungrieved loss. You could not bury loved ones. You could not get that finality that we usually get. I knew that in my own family. I lost a cousin early on, and it was almost 3 months before we could bury him. And most of us did not get to go to the funeral. Most of us viewed it on Zoom. Well, that's not necessarily resolving our grief and our anxiety and our depression. And prices being high and having food instability and housing instability, that makes you anxious. That makes the parents anxious. And I can tell you, anxious parents breed anxious children. That really is a truth. And so we really have got to pay attention. On our campus with the Steve Fund, we knew that even our students, even though they're being trained to go out in this world to help, but they needed support too. They experienced a pandemic too and lost some things, and lost loved ones as well. So we just had to really work with them. And so a generous donor and people that saw fit to improve Meharry's mental health embarked almost a year ago. It'll be a year in August on this needs assessment to see if we could start improving the overall mental health, not just in medicine, but in our entire campus. So I think efforts like that are very important because one, there was a disparity anyway, and now we have had some added adversity to that. So it was great timing, if you will, that was done. And we look forward to the next few months in putting some of the recommendations into place.
I just want to piggyback off of what Dr. Pinnock was saying as far as depression and what it can do to you as a person, because I think that Black people falsely think that having mental health issues means that it's a sign of weakness. And depression and other mental health issues has been shown in studies to contribute to oral health issues. And when a person is suffering from depression or stress, that they tend to not concentrate on personal hygiene or oral health hygiene, and that leads to gingivitis, periodontal disease, and tooth loss, which can lead to other health issues, ongoing health issues. And so those are kind of things that we need to educate people on. And there's a reason that when we're flying on a plane, that the airline personnel will tell you to put your oxygen mask on first, is because you're no good to anybody else if you're not caring for yourself. And so it's just something that I wanted to point out, that we need to think about those kind of things as well.
Yeah. I just want to say that when we think about mental health and we go far back, the whole idea of what people thought mental health was, people would say that you had a nervous breakdown. And so you ask yourself, what does a nervous breakdown mean? You know what I'm saying? It's a misnomer for mental health. There are many mental health conditions that are out there. Mental health conditions are multifactorial. The treatment of mental health conditions are also multifactorial. And the idea of curing a person, that is curation of a mental health condition, is something that you have to think about. Usually it is to try and help a person get through or cope with their mental health condition. And so what you've seen is a lot of celebrities that have come out and have been very verbal about their mental health and wellness. You've had, athletes come out and talk about it. And again, what it has done, it has made people aware. And of course, you've had the COVID-19 pandemic that has put pressure on individuals' mental health in so many different ways. And again, we have to talk about our children here as well. Children, when you look at them, many of them are experiencing depression, anxiety, and even suicidal thoughts in ways they have never done before. They have been homeschooled and they have been away from their friends for many months. And of course, we have been in isolation. And of course, when you look at the elderly being in isolation and the impact on their mental health is something that we're just starting to try and understand. So when we look at mental health of those particular individuals that are marginalized, okay, and when I say marginalized, I'm also talking about people that are incarcerated. I'm also talking about LGBTQ, migrant farm workers, persons that are experiencing homelessness. And you ask yourself, what is the impact of COVID-19 on the mental health of those marginalized populations that we don't talk about? And so we have more to do. We have more awareness to do. We have more referrals to do. And we have more listening to do.
I don't want to belabor the point because I agree with all of the points made by my colleagues here. I just want to point out that we don't work in silos here. Everything matters. One of my favorite TV shows is The Wire, and the theme for The Wire is all the pieces matter. And we're seeing here, just in this discussion, from your oral health, your mental and behavioral health, your traditional, what we consider to be physical health. All those pieces come together and interact with one another. And if those pieces are out of whack, if they don't fit in the way they're supposed to fit, then you're going to see the results that we see. And I love the point that Dr. Alcindor made about pressure, because pressure busts pipes, especially when those pipes are not as healthy as they need to be. And so, what COVID did was show us where our weaknesses were. It showed us, and in times where when we are under tremendous pressure, where we are weak and where we are exposed. And hopefully we can learn from that. And in the times when, because we will get back to a point where we are relatively, stress-free, as it were. I mean, we're never stress-free, but definitely away from the pandemic. And when we are in those points, that's where it's most critical that we look after our mental health, so that we have these coping mechanisms that we can then call upon during those times of stress and deal with that stress in a healthier way. When you get into survival mode, you're not thinking a whole lot. You're just trying to survive. And we have to have some mechanisms in place so that when we're in survival mode, when we go into this primal way of thinking and acting, that the instincts are there, and we can call upon them to help us.
I want to just make one comment that I think is very important, and that is people that are out there that are suffering from long COVID, what we call post-COVID syndrome. This is a situation where even if COVID-19 was gone tomorrow, these people will still be suffering lingering symptoms. Some of them are new, some of them are more debilitating to the point where they cannot hold down a job. So you're asking yourself, what about those people that are out there? And again, when you talk about long COVID, as much as anywhere from 10 to 35% of people that would be infected naturally with COVID will develop long COVID. And if you've been hospitalized or under mechanical ventilation, that gets to about 85%. So there's a lot of people out there with long COVID, and long COVID is a crippling illness that somehow never goes away unless somehow managed. And so one of the things that I'd like to stress today is that if you're out there and you're suffering from the fatigue, arrhythmia, kidney disease, hypertension that long COVID can bring on, then you need to consider getting the vaccine, because a fraction, about a third of those individuals that get vaccinated after having long COVID, they get better. Mm-hmm. And so it is worth being vaccinated. And of course, the vaccination, even post-infection, the vaccination will reduce the number of long COVID symptoms you might have. And so I just want that word to get out.
I just like to piggyback on Dr. Alcindor. As I said, Monday, they start giving children 5 and under the vaccine. Children are not immune to long COVID. They have long COVID too. So, you know, adults can think for themselves, but we have to really protect our children and keep them. And they're getting long COVID. And one particular aspect of it was the inflammatory syndrome that we had seen in children. But now what we're noticing, at least in a couple of studies, is looks like diabetes is one of the things that seems to be a fallout for our children that have had COVID infection and are still recovering. So.
Thank you so much, everyone. Great points. Especially, you know, the kids, you know, 5 and under can start getting vaccinated. That's a really good thing. Please, if you have any questions for our experts here, please post them in the chat so that we can get to your questions. So I know that we've had various COVID testing and vaccination fairs at churches throughout the city. Should the church play a role in health matters within the Black community? In your opinion, would it be helpful? So I know oftentimes people may think of healthcare as just being medical, but dentistry plays a vital role in the overall health as well. So Dr. Davis, you want to lead with this? Well, I'm sorry, Dr. Perkins Davis, would you like to lead with this answer?
That's fine. Absolutely. Thank you so much. I really believe that community and faith-based organizations can serve as trusted partners and work with us as reputable health organizations and share information within the community. And the church can be helpful for passing along messages for prevention and care. They can serve as conduits and link their members to resources for treatment, for working with community organizations for low-cost services. And I really think that it's helpful when there's partners with Meharry, say, for instance, when they work with faith-based organizations. I think that can be a really great thing. And so I think that it's very positive when the church works with organizations. And we've had, Meharry has had very good success when working with the church for vaccination efforts. We partnered with a lot of community churches and went out on the weekends and performed vaccinations out there. Again, I'm always with the oral healthcare, obviously. So we do oral healthcare initiatives with the church. We do back to school efforts with the church. And I think efforts like that are very successful in passing along all sorts of messages. And again, with the trusted partners, I think that because we're providers that look like a lot of the members in the church, the members trust us because we are giving information, we look like them, and then we're an organization and a healthcare facility where they can come and seek care here with us. So I think it's all positive.
Yeah, I wholeheartedly agree. To the point, initially when we started this discussion, I mentioned the trust and the breakdown of trust. The church is instrumental in helping us to rebuild that bridge, because the church, as Dr. Perkins Davis mentioned, is a trusted voice in our community. And we need to make sure that the information is disseminated. A big part of what's happening right now is misinformation and disinformation, as it were, bad information being put out there. And the church can help in so many ways in alleviating some of those things, because again, those voices behind the pulpit in the congregation are essential and trusted. And so, as a gateway to health, think about all of the screening events that occur in churches, the blood pressure screening, the oral health screenings that occur in churches after church, during vacation Bible schools, during the revivals, all those kind of things. As institutions start to come back to in person, it's going to be essential that we still play a part in that and have a role in terms of being a trusted gateway. And the church is that route for a lot of us. I think that, when I think about my patient population, my patient population has a strong faith base, and they come to me and sometimes they let me know that it's because of their faith that they are where they are. And to that point, we have to rely upon our churches and our ministries to give good information to our patients so that they can continue to be healthy.
Yeah, so I'd like to say something about this. It's a different view, but it has to be heard. And that is, all pastors are not on board with COVID-19 vaccine initiatives. And so we found that out very clearly. There were some that wanted to do this. There were others that wanted people to come to church in full force without masking and so forth. We had pastors in my community where I live telling people that if they wore a mask, don't come to church. And so we have to give both sides of this. And yes, I agree that pastors in their capacity can deliver a message, a trusted message on a given Sunday to 30,000 people. And the idea is that that's very important. The church has a critical role because it is the foundation for many communities in Black among Black populations. And so the idea is that when you're talking about the church, you're really talking about the pastor. And the idea is that that relationship with that pastor is very important. And the idea is that I talked to 100 pastors at one time in Chicago, and they wanted me to talk about everything that was bad about HIV. But when I came back to Tennessee, there was only certain chosen words that I could say in church to the congregation. And then I went to an underserved community where things were happening in a community that were just things that were out of control. And the pastor said to me, when you talk, I want you to show every ugly picture you can find on HIV, because we have some things going on here that we have to deal with. And so what I'm saying is that as the message goes and what you're trying to do, the pastor will have a lot to say about how that will happen. And the idea of getting pastors on board and the so-called training of the trainers, where the pastor is given information that is correct and important to deliver to a congregation, and their willingness to do that. And again, outside of their calling for what they have to do for the congregation, you have to somehow make that happen.
I'd like to add, churches have always played an important role in particular, let me just give you an example. In the Black community, when sudden infant death syndrome was really being emphasized and putting babies to sleep on their backs instead of their stomachs, they didn't go just to the reproductive age moms. They went to the grandmothers in church, and the grandmothers in church were the ones that really start making the change of how the baby slept. So certainly, I would say that the church has played a great part in pediatrics, and especially in communities of color, in getting the message across. Because mom and dad might not get it, but if grandma and granddad get it, and they're going to make that happen for the family, then you won.
Yeah, I just want to add to this that during the COVID pandemic, we saw few people going to church on a regular basis, but those in-person people that were there, they were elderly people that were still coming to church in person. They were distancing and they were wearing masks, but they were in person. And the idea that became a very good opportunity for us to be able to participate in that particular session with them, that is going through and participating in the service. And then after the service was over, the pastor would give me 10 minutes to give my COVID speech about how important it was for everybody in church to get their boosters. We were waiting there with vaccinators right around the corner, right after the service was over, to vaccinate them. And that was a good finish for us.
Thank you so much, everyone. So we're going to hop over into, we have one question in the chat that we're going to answer. Well, I'll pose it and you can answer it. So what is a good natural treatment for type 2 diabetes? Are there any medications worse than others? Anyone can answer it.
I guess as the internist, I'll start off with it. In terms of natural homeopathic treatments for diabetes type 2, I'm not as well versed in anything that has been shown to be very effective. And my colleagues here may have some alternatives. I go with my bread and butter from my training. And the medication that is the most helpful in terms of treating type 2 diabetes for just about everybody, but especially people of color, is going to be metformin. Metformin is it has the side benefit of weight loss in a great number of people. Moreover, it has the effect of not causing people to have low blood sugar episodes. At least that's not something we see very often with metformin. Obviously, those people that have kidney problems, and sometimes kidney problems and diabetes go hand in hand. So those people that have those kind of issues probably need to have a little bit of watch and latitude with that particular medication. But metformin is our go-to. Now, I'm seeing in my particular practice a lot of good results with Ozempic. Ozempic is becoming a very effective medication in terms of dealing with diabetes. And again, that weight loss aspect, because there's so much correlation between your weight and your status as a diabetic. And so that medication Ozempic, I'm seeing some good results in my patients. A lot of my patients are requesting it, and whenever I'm starting to see a lot of people to request medications, it makes me want to look and do some researches to see what is really going on behind the scenes driving that. And it's the weight loss aspect of it that has been really key. Now, as far as what's worse than others, the medications that I'm seeing that have a kind of a negative effect on our community in particular, and they are helpful medications. So I want to caveat it by saying that I don't want to slander these medications, but I want us to be very careful about the sulfonylurea medications, especially as we get a little bit older. The sulfonylurea medications, and we're talking about glimepiride, glipizide, the medications in those categories, will cause people we know pretty reliably to have low blood sugar episodes, particularly if they don't eat. And, as we get older, a lot of times eating is not always one of the priorities. I know, well, my dad, that's not the case, but for a lot of other people, eating is not always the priority for them. So, you have to be very careful with those particular medications in terms of the side effects that exist. But I really, at this point, especially Dr. Alcindor is in research and he's on the cutting edge of a lot of the medications. I know he's more in the virology realm, but maybe he knows something about some of the natural homeopathic medications. The one other thing I'll say before I jump to him is that your diet plays a significant role. And the diet and exercise are no substitute for medication. So, you definitely have to handle that end as well. So, those foods that we love, I have these discussions every day with my patients about those starchy foods like mac and cheese and mashed potatoes, all these delicious foods that we love. Unfortunately, they're not really great for us when we have diabetes. And we have to eat those, not necessarily eliminate them, but eat them in moderation. And being physically active. Again, there's no substitute for being physically active. And you know, I know that there are limitations in terms of, like, you know, where we live and the safety of our environment and things of that nature. But, you know, we have to find ways of making it work for us so that we stay active and allow the tools, our bodies, to work for us and not against us. So, but I welcome it to any of my other colleagues if they have anything.
Yeah, so Dr. Smith, I agree with you 100%. And one of the things is the weight loss, and that component is so very important. And the thing about it is that the weight loss usually comes with being disciplined. And that's the hardest thing for most people with diabetes. Many of them are overweight. Many of them feel, in a lot of ways, that eating is the last frontier they will not let anybody challenge. You see what I'm saying? But if you want to do something and you want to not be able to be tied to medications, because metformin, you will have to take that for the longest time of your life, as long as you're diabetic. But you're saying to yourself, how can I do this in a way where maybe I don't have to take medication? To me, that would be an ideal way to do it. And the way to do that, I think, is to lose those 30 pounds you don't need, and to lose them and keep them off. And I think what happens is that when you lose weight and you find out how good you look in your new clothes, sometimes that's enough to keep you on your regimen. Another thing is that I want to say something about a person with diabetes that might get COVID. So if you have diabetes, you're at an increased risk for the most severe complications of COVID. And I just want to explain to you a little bit how that mechanism works. It turns out if you're hyperglycemic and you get COVID, one of the things that will happen to you, because you're at increased risk, you will develop a cytokine storm. This is like a inflammation hurricane. And the idea is that inflammation hurricane, it happens in your lungs. And the one thing that they will do for you in the clinic to bring this down very quickly is corticosteroids. And the idea is that when you give a person corticosteroids, it will increase their blood sugar even more, even if they're hypoglycemic. This has been associated with lung problems, lung issues, and it's been shown to inhibit viral clearance of a person that's infected with COVID-19. And so I wrote about this in the Journal of Clinical Medicine, looking at racial disparities associated with COVID-19. And what I do there is I explain all the different mechanisms of some of the most chronic underlying conditions that put you at great risk for COVID-19, including diabetes, hypertension, cardiovascular disease, and lung disease. And it's very clear that when it comes to all of those comorbidities, African Americans are at great risk, and there's a disparity for all of them. But I just want to say one other thing, and that is when we think about something like hypertension, we know that hypertension, and we know that all the risks that are associated with hypertension. We also know there's medication that's relatively inexpensive out there to treat hypertension. And the idea is that if we said tomorrow that we are going to diagnose everybody in America with that have hypertension, and we're going to provide them with medication for treatment, it would fundamentally change the outlook in terms of clinical disease for people and early death associated with Black Americans in America. And the idea of doing that, there is one caveat, is that people will not stay on that medication. And again, one of the myths that's not so much of a myth when it comes to hypertensive medications is that it will lead to erectile dysfunction. And let me tell you, that's enough to keep Black men away from hypertensive medications as long as they can still make it. And so what I'm saying is that being able to get out there and do something that will not keep your heart rate up too high for too long. And the ideal way of doing that is simply walking. And you can walk those pounds away at your own pace. And I've seen my brother, one of my brother-in-laws that had type 2 diabetes, it went away after the 30 pounds went away.
Thank you so much for your answers. So we're getting really close to time, so I think we got enough time for one more question. So when it comes to health and wellness, what are some beliefs held in the Black community that need to be put to rest? Anybody can take this one.
Well, one thing that I see that I hear quite a bit from people is about big pharma and the effect that big pharma has, and how they are influencing the decisions that are made in healthcare and things of that nature. And I really want to advocate against that. I don't make any more or any less money as it relates to what medications I prescribe or things of that nature. I go by evidence, and I teach my medical students and my residents by evidence and by what is studied and by what is safe and effective, and particularly for our community. I like to read my journal articles and then compare those numbers. How many African Americans were treated in this trial? Is this something that's valid for our group? And if not, if it's not been proven, how can we look and see whether this is something that's valid for our people? Those are the drivers for me. And so big pharma is not something I really think about from my end. I try my very best not to be influenced by what big pharma has to say. I haven't been to any drug rep dinners or any of these other things that are common myths about the treatment of our patients. Really quickly before I go, I did want to share a couple of resources that I found in terms of, especially for mental health, because that was something that we talked about and I thought was really, really important. So Therapy for Black Girls and Therapy for Black Men, and the Black Men's Health Project by Johns Hopkins. Those three things. So again, Therapy for Black Girls, Therapy for Black Men, and the Black Men's Health Project. And all of these have online components that can be very helpful for our people, and to help them to be able to have resources and advocate for themselves when they go to see physicians. But that's what I wanted to share.
Yeah, something I would like them to put to rest is getting their medical information from people that are not professionals. This is a big problem across the board. No matter what kind of clinical condition you might have, there are people continue to get their medical information from a person that never went to medical school, or for that matter, a person that is not in that area of medicine. And so getting your medical information and making medical decisions from that information from a non-medical person is something that has to be put to rest. It is the thing that leads to misinformation, that contributes to conspiracy theories that make people hesitant in terms of going to the doctor or physician, hesitant about getting a vaccine and so forth. And so get your information from a trusted source that has your health and wellness in mind. And that information has to be accurate as well as current.
This is not maybe a myth, but this is something I really want communities to think about, both adult and children, is getting enough sleep. Sleep is very important to all the things that we have pretty much talked about today, in fighting illness and helping with chronic disease. And so if your sleep is being disturbed, if your children's sleep is being disturbed, please seek out help for that, because that really can be preventative in some of these chronic conditions we've talked about. And it really does lead to self-care. Getting enough sleep is really helpful.
I think I have 5 seconds really quick. Bad teeth run in my family. Oftentimes it's poor nutrition, unhealthy diet, poor oral hygiene habits, alcohol, tobacco. So just take care of yourself, okay?
All right, we're at time. Thank you so much to all of our guests for joining. Thank you to our expert panelists for just sharing your knowledge and wisdom with everyone. Go get vaccinated, take care of your health, and we just thank you for joining us today. Enjoy the rest of your afternoon.
Bye-bye.
Thank you for having me.